this pandemic started, and we didn't know as much information.
So that's really a good question. And first of all, half of it you're seeing, which is you're seeing the earlier detection, the earlier diagnosis, the larger availability of testing. Obviously, the president had it before anyone else. The White House
She's asking,
testing for a while now. But
how would you treat this differently, not seeing that he's over 70?
Now, of course, were he to get sick, God forbid, we have more treatments to offer than we ever have before. We know how to manage this better. We know how to use medications. We know about blood thinners, Julian, that we weren't even using before. We know that this is a disease that causes a lot of blood clotting. We know about the anti-inflammatories. We use steroids in this condition. We use remdesivir, antivirals. We know how to manage ventilators. All of this we didn't know before. All of this has led to a lot more people, tons more people surviving this than were at the beginning. And then there's also an implication with studies going on now that this virus is probably becoming less severe over time. That is very characteristic of pandemics, by the way, but it is not becoming less transmissible over time. Seems to be more contagious. And that makes it even more important, by the way, something that you've both been featuring over the last few minutes, which is these rallies are occurring in multiple states all around the country with people too close together, not wearing masks sufficiently, and some of these states are our current hotspots, the Midwest. So that trafficking, that traveling is helping to spread the virus and maybe one of the reasons we're seeing these cases.
Dr. Siegel, the Biden campaign faces a decision. Do they take advantage of this opportunity where there quite frankly will be a gap in the time the president is able to hit the trail and go do rallies, go do things like that? Or do they quarantine Joe Biden? Because let's face it, on Tuesday night, as you see right there, the president and Joe Biden, albeit socially distanced, were close to one another for 90 plus minutes.
You know, Todd, I would like to see some kindness coming out of the Biden campaign. That would say a lot to me. There's been so much viciousness and vitriol in this campaign and this election throughout the entire country. What a nice time for former Vice President Biden to wish President Trump and Melania Trump well. But I hope they don't take advantage of it politically. But I think maybe it is a nod in the direction of virtual campaigning more than these rallies. But of course, you know, we've seen protests going on the side. I don't want to say on the Democrat side, but the Democratic Party, of course, has not gone against some of the protests that have gone on in the cities across the country.
Dr. Siegel,
There's so little.
That's politically. I'm asking you medically.
Right.
If you were in charge of the campaign, the Biden campaign, from a medical perspective, would you tell Joe Biden that the risks do not outweigh the benefits? You should quarantine Joe just to be safe.
I think no. If you're asking me whether I think he needs to be quarantined because of where he was on that debate stage, no. But I think this is a wake-up call for both campaigns to go even more in the direction of virtual. I see what your question is, Todd. No, I don't think that I think he should be tested because of that. Maybe tested 2 or 3 times because of that, not quarantined because of that.
Okay. Dr. Marc Siegel, excellent information. Thank you very much for joining us. We'll check back in with you.
Thanks, Doctor.
It is 39 minutes after the hour.
There he goes,
President and First
Dr.
Lady
Marc Siegel.
testing positive for COVID-19. Continuing coverage right after this break.
There it is.
Man.